Thanks so much for joining us tonight. Amy Nay and Brian Schnee here with you. The Utah Department of Health and Human Services says on any given day, there were about 15,000 people experiencing homelessness in Utah, most of them in Salt Lake City. Now, there are no statistics on how many of them are suffering from mental illness.
But Salt Lake City does have a team of social workers who respond to 911 calls involving mental health concerns, particularly among the homeless. Fox 13's Todd Tanner has this exclusive look into the work they do in tonight's latest 360 report.
Fire dispatch, Kelly.
He is downstairs, shirtless, and he's saying he needs an ambulance. He says there's mice growing all in his body.
Okay, I can send some help out.
On this day, social worker Amelia Hilbert and her crew are the help. They arrive at a housing complex run by the Road Home Shelter.
I would like to go to a hospital.
The man we'll call John wants a CAT scan to help locate the mice he thinks are inside his body. But the officer suggests the source of John's itching may be something else.
When was the last time you used meth?
It was the night before.
It's a pretty common thing we hear from lots of people sometimes when they use, especially meth or spice, that they feel they have those same feelings that you're having.
John won't be going to jail. Amelia's fellow social worker, Leo Avila.
How about you take a nap and then see how you feel after that nap, and then I'll give you my card and you can call me if you're still experiencing what you're experiencing.
Okay, that's fine.
Yeah.
It can really vary day by day.
Karen Montano is the manager of the Salt Lake City Police Department's Community Connection Team, a crew of about 16, including therapists, social workers, and officers with training in crisis intervention.
When a call comes into dispatch that's labeled under mental health, substance abuse, or homelessness, our detectives will attach themselves to that call and we can go out with our social workers.
Doing well?
I'm fine.
The idea is that some people, even if they have committed low-level crimes, may benefit more from social services than going to jail. Cycles of incarceration and repeated calls for emergency services for the same person could be curtailed through case management and mental health care. Salt Lake City actually tracks the individuals who use emergency services the most. They have a top 20 list. It's updated quarterly, and last year alone, they say those 20 individuals called for service 1,042 times.
Sometimes people just need someone to talk to.
But the next person they've been called to assist
Here's a cop, I don't want to go to jail.
does not want to talk to them.
Oh my God.
At least, not at first. The woman we'll call Mary is outside a shelter.
She is one of our highest utilizers in Salt Lake City.
In the month of March, Mary took 17 trips to the emergency room, costing taxpayers an average of $1,500 apiece for a grand total of $25,500 for just 1 month of care.
I just got out of the emergency room. I spent the night in the emergency room last night.
Unable to provide long-term treatment for Mary's emotional trauma, emergency rooms and hospitals release her, and the cycle begins again.
In her mind, she's in crisis 24 hours.
As social workers take her inside the shelter to talk, a volunteer provides a calming Tai Chi lesson out on the front lawn.
I want to work with her treatment team to try to create something that maybe they haven't tried before.
The incentive Leo offers Mary.
Today, she mentioned that one of her favorite things to do is eat Mexican food. So we will, if she sticks to the plan that we come up with today, we'll make that reality for her.
The next call takes the Community Connection team to a secluded spot behind a big box store. Nearby property owners are troubled by the man living in the tent beneath the billboard.
He's been homeless for about 2 years.
We'll call him Jason.
Sometimes they have a criminal background to where they get scared to go apply for apartments because they think they're going to get rejected. And we work closely with a lot of landlords.
The team seems optimistic about helping Jason if he will let them.
It could be a lot of rapport building on my end to help him get to that point where he can trust me.
Our social workers will do a lot of follow-up work.
In 2016, Salt Lake City was one of 6 police departments across the country to get federal funding to start a community connection team. Last year, the city budgeted an additional $1.34 million to sustain the program.
Are you and your team of 16 people enough to keep up with the nearly 15,000 homeless people?
No, I don't think it's enough, but I also don't think it should be solely our responsibility to be present all the time 100%.
They do have round-the-clock community partners like shelters and drug treatment centers, but the Community Connection team only responds to calls during regular business hours.
We would like to see that happen on more shifts.
Sergeant Scott Stuck has been with the police department for 15 years, including the Operation Rio Grande years, which saw arrests for even the most minor violations. Now he's part of the Community Connection team.
It's the opposite end where we're trying not to arrest someone when we can, to make sure that we're encouraging them to come back and feel confident and comfortable with us.
If you could change one thing with mental health care that would help you to help other people more effectively, what would it be?
I would say have more like walk-in clinics available for people to immediately receive services.
Montano says this could help individuals keep medications in check rather than letting conditions like bipolar or schizophrenia crescendo into a costly or life-threatening crisis.
We have the John Huntsman Mental Health Institute, which has a receiving center, which kind of functions that way.
I feel like there's something going on.
It's been a few weeks since we met John. He ultimately decided no CAT scan was needed. He never went to the hospital, and he still has housing today.
Hi. How are you?
I'm good. How are you?
Dinah, D-I-N-A.
In the month of April, Mary went to emergency rooms only twice, and one trip, her social worker says, was for a physical ailment.
Hi. You taking my picture? Hi, Dinah. Hi.
And yes, she was treated to a favorite meal. Jason never contacted the Community Connection team, and we couldn't contact him either. The spot under the billboard is now empty.
Communication is probably one of the most difficult things with a person that's currently experiencing homelessness.
Todd Tanner, Fox 13 News, Utah.